Hello, welcome once more to Ask Your Midwife. I'm your midwife, Patience Efrifa. Today I'm going to continue the congenital malformations, and the first congenital abnormality I'm going to talk about is anencephaly, and I'm going to show you some pictures after this for you to know how the babies who are anencephalic, how they look like. All right. Anencephaly is a serious malformation in which the vault of the fetal skull and forebrain is absent. When I say the vault of the fetal skull, it involves a lot of bones. I wouldn't like to confuse you, but for midwifery students, they know that the vault, that is where the baby presents with during birth. Okay, so the vault of the fetal skull and then the forebrain is absent. And the meninges are exposed as well. It is often accompanied by spina bifida. Spina bifida is one of the neural tube defects due to a deficiency of folate or folic acid. The condition is incompatible with life. When I'm saying incompatible with life, meaning that such babies are either born stillbirth or after a few minutes of delivery or birth, they die. And it's mostly common in female babies. Some of their features are that the babies have large protruding eyes, and they look like that of a toad or a frog. They have wide shoulders, and these wide shoulders makes labor very difficult. All right, and then with the diagnosis, mostly they are being diagnosed during antenatal. That is why we always say that when you are pregnant, make it a point to come to the hospital early, so that when a congenital anomaly is done for you, that is, a scan is taken, we can be able to detect that this baby is presenting with such an abnormality. And apart from ultrasound scan, which can identify these abnormalities, X-ray too can pick it up. And then we also have some other diagnoses which the doctor or gynecologist may request that you do, which is the presence of alpha fetal protein. That's where we do the amniocentesis for you. And then we also, when there is also polyhydramnios, then it should also trigger that there is an abnormality somewhere, because ideally from the 10th week onwards in the neonate's life, that's the baby in utero or in the uterus, from the 10th week they start producing urine in utero, and the urine that they produce is very sterile, so they urinate. And then the urine is the same, makes up the water surrounding it. So the same urine that they pass when they are in the uterus is the same thing that they drink. So a normal baby is supposed to do that physiologically. But when baby is producing urine and is not being able to drink, then it queries that there is an abnormality. That is why you realize that the mother's abdomen looks very large. That is what we call polyhydramnios, meaning that the amount of fluid in uterus is plenty or is too much. So that is how can we say poly. And the hydramnios is, when we say hydro, we mean water. All right. What's the effect of such a condition or such a congenital malformation on labor? That is, during labor, what happens? Most of the times we are saying that these babies present with the face. And one thing I would like you mothers to know is that, or my mothers to know, is that the face, when in utero, when it comes to development, the face does not mold. The face does not overlap. The face is fixed, so it cannot overlap or mold and cannot pass through the maternal pelvis. So it makes labor difficult. That is one thing. It makes labor prolonged at the same time. And then the shoulder, because it has broad shoulder, and it can cause perineal tears in the mother. All right. Hello, this is your midwife, Patience Efrifa, and I hope you enjoy the presentation. As I mentioned earlier, I'm going to do this abnormalities one after the other. I'm going to take them one after the other for us to go into it, and I'll try as much as possible to send you more pictures for you to have a clearer idea of how some of these congenital abnormalities are. My sisters, it is no joke. It is very disheartening if a mother should come to the labor ward and then give birth to such babies. For mothers who are lucky enough to go through antenatal session from 18 to 28 weeks, we do what we call, but mostly it's 28 weeks. But when the mother is having an infection like rubella or syphilis or malaria, we try to do the anomaly test early so that early counseling can be done. But for those who don't have any condition, we still do this anomaly test at 28 weeks. It is a scan which is done to detect any anomaly that will be detected in the baby at that gestational age. And such families or such mothers or couples are being counseled, and then the way forward will be decided by the couples. Yes, but the doctor too will also come in to tell you the pros and cons, all the advantages and disadvantages, and the effects that you, the couples, or you, the parents, will go through. Then it will be left unto you to decide whether to go on with the pregnancy or to do away with the pregnancy, and then prepare for a second or another pregnancy. So ask your midwife. As I always say, it's a program which has come to sensitize every mother, because if you're in the labor ward with us, or if you are the maternity with us, and you see what especially mothers, pregnant women, to go through 9 months pregnancy, my brother and sisters, it is no joke. 9 months pregnancy for you to give birth to babies with gross anomalies, or to 9 months pregnancy and baby will come out stillborn or dead. You can imagine the psychological and emotional stress or trauma such women go through. And also, one thing I would like us to know is that don't joke with your folic acid intake. Whether you are pregnant or whether you are planning on giving birth, or as a woman, please take your folic acid. Take it as a daily supplement. Also, one thing too is avoid alcoholism, avoid smoking. And when you are pregnant too, try as much as possible to prevent being exposed to radioactive rays. All these things contribute to congenital malformations. Aside that too, when you are pregnant, inculcate the habit of seeing your doctor or your midwife every time you have a question or a problem. Please and please again, don't go to a pharmacy or a drug. Even pharmacy crowd will not even accept you because you have to go there with a prescription. But don't go to a drugstore and buy on-the-counter drugs. I'm hammering on it again. Desist from buying on-the-counter drugs without prescription from your doctor, because you are a pregnant woman. And as I always say, every pregnancy is a risk. Every pregnancy is a risk, because there are so many changes that are happening internally and externally. So there is both internal pressure or stress, and there is external pressure or stress. Please, for you to have a successful labor, a successful prenatal and postnatal, please don't joke with early reporting and don't joke with antenatal clinic. Thank you very much. Please, once more, the name is Patience Efrifa. Try as much as possible to share this video, because sharing the video too will help someone. Others may not know. You may think that people know, but bear in mind that it's not everybody that knows all these things. Share the video, like the video, and subscribe to my channel too. You can find Ask Your Midwife on Facebook as well. Aside that, the reason why I even chose this topic, Ask Your Midwife, is also because I want you to ask questions. Ask questions. I am your midwife. Ask questions so that I can help to address it for you. Thank you very much.